I'm going to start with our healthcare sector. The Pakistan People's Party's approach has been that we believe that healthcare should be a fundamental right. That if the people of Pakistan, or if any citizen, cannot afford treatment, it should not mean that this is a death sentence. And we have invested over the course of 3 governments in setting up free of cost medical facilities and health infrastructure all across the province. And not only are our facilities that I'll just go on to talk about free of cost for all our citizens, but also of international standards. I'm going to start by talking about Karachi's JPMC. Actually, before that, I'm going to tell you that we've invested over the 3 governments, and we brought up our health budget from 2.9% of the Sindh's budget to 10% of our budget. As far as Karachi's JPMC is concerned, it is our sort of the cornerstone of Sindh's health system. It's our biggest hospital in Karachi, and it was handed over to us after the 18th Amendment from the federal government. Along with other institutions across the province, the healthcare sector had suffered from a neglect, from a lack of development, a lack of investment for more than a decade from when we came into office. And when we inherited the JPMC, our infrastructure was dilapidated. We had a capacity of 1,100 beds. And over the course of the Pakistan People's Party's government, we've now transformed this hospital in partnership with the people of Sindh, with the people of Karachi, with the philanthropists of Karachi, and as a result of heavy investment by the Sindh government into the country, one of the country's leading hospitals. We've added a 550-bed surgical complex and OPD, a 120-bedded psychiatric ward and OPD, a 110-bedded neurology ward, and OPD, top-of-the-line equipment. For example, we have the CyberKnife technology for the treatment of cancer at JPMC. This facility, again in partnership with charitable organizations, the Patients AIDS Foundation, we not only made it possible for this top-of-the-line cancer treatment to be available in Karachi, but we're also the only facility in the planet to offer this expensive treatment completely free of cost. We've taken the JPMC bed strength from 2012, it was 1,100 beds, to now 2,208 beds. So we've doubled our capacity so far. If I just talk about JPMC's CyberKnife and cancer treatment facility, we've served patients from 178 cities and 24 countries. And our CyberKnife facility and other tomotherapy and equinox sessions and all of this component, we've served 250,000 patients. It says here, now I don't know whether that's daily or monthly because it's missing in my presentation, but this is one of our most expensive treatments that we afford to our citizens, absolutely free. And I just wanted to highlight that while 46% of our patients, so less than 50% of our patients who receive this treatment are from the province of Sindh, 31% of patients who receive this treatment are from Punjab. 11% of the patients who receive this treatment are from Khyber Pakhtunkhwa. 7% of the patients who receive this treatment completely free of cost in the province of Sindh are from Balochistan, and 5% are international patients that come to Karachi's hospital. So the JPMC that we inherited with 1,100 beds in 2012, we added our 200 bed in 2020. We added our 500 bed surgical complex. In 2020, we also added our food complex, which feeds 500 people daily, completely free of cost. In 2024, we added our psychiatry and neurology department of 120 beds. And as I mentioned, our bed capacity from 2024 went from 1,100 to 2,200 beds. Going forward, from now until 2028, we plan to add a new 12-storied, 600-bedded, fully equipped medical tower with MICU, CCU, cath labs, endoscopy, a new 6-storied officers' ward with 60 fully equipped private rooms, a new 10-storied, fully equipped accident and emergency and trauma complex, along with other facilities. So by 2026, our employees' medical block with 60 beds. Again, 2026, our medical complex by 50 beds. Our emergency tower, that I mentioned, 722 beds. And our vision is that by 2028, we want to take our bed capacity just for JPMC alone to 3,200 beds, which will almost triple our capacity. We are already the largest hospital in Pakistan as it stands today, and by 2028, this one JPMC will be 3,200 beds. Alongside JPMC, within the same compound in Karachi, we also inherited the NICVD, which is Pakistan's cardiology hospital. We've managed to transform the NICVD as Pakistan's the largest free of cost cardiology network in the region. That includes the specific NICVD Karachi hospital that's right next to JPMC and is part of the same complex, but also 11 hospitals for free of cost heart care across the province. That includes our this building that we've redone, the NICVD by JPMC, NICVD Liari, NICVD Larkana, NICVD Sakhar, which is the building you see in the background, NICVD Hyderabad, NICVD Khairpur, NICVD Mithi, NICVD Tandu Muhammad Khan, NICVD Nawab Shah, and NICVD Baldia. These are all state-of-the-art, 100% free of cost, full-fledged cardiology hospitals that we've set up across the province. Along with these 11 hospitals, we've also set up 30 chest pain units in each of the 10 districts of Karachi and across the entire province. The thought behind this is that in cardiology, sort of the golden rule is if you've had a heart attack, if you can get to hospital within 90 minutes, you save a person's life. And we've managed to establish such a system across the province that not only provides this facility to our citizens, it provides it on their doorstep and completely free of cost.